In this video, I'm going to show you some key exercises you can use to decrease hip pinching, that nagging, stiff, or pinch feeling in the front of your hip. What's going on, guys? My name is Dr. Nick Bonforte, physical therapist. So hip pinching sensations in the front of the hip is a common problem I often hear, and a lot of times this pinching sensation is a result from a mobility problem at the hip. The hip moves in various ranges of motion. It moves into what's called hip flexion and extension, hip adduction and abduction, and then hip internal rotation and external rotation. Now, more often than not, it's usually a lack of rotational mobility at the hip that contributes to this pinching sensation in the hip. When the hip capsule isn't as flexible as it can be, this can lead to abnormal mechanics at the hip, leading to some of these pinching sensations going on. When you further complicate this and you don't get it looked at, over time, the hip pinching can get worse, and you can start to get actually a bony development on either the acetabulum, where the hip socket is on the pelvis, or the actual femur bone, the femoral head. When there's growth, bony growth on these two structures, it's referred to as a cam or a pincer lesion. Cam lesion is just a lesion on the femoral head, which is on the bone. And then a pincer lesion is a bony outgrowth on the acetabulum or the hip socket. Now, when you're dealing with a cam or a pincer lesion, that can be a totally separate issue and potentially might need a surgical intervention. In this video, you're gonna learn some key things that you could do to minimize that hip pinching sensation you potentially might be feeling. With these simple exercises, it can help the hip move a little bit better and limit the likelihood of developing these types of issues. Let's dive into some of the exercises right now. So this first exercise, we're working on just banded distraction at the hip. So now, will this be a long-term fix? Absolutely not, but this is a good way that we can provide some input to the joint capsule and help basically move the bone a little bit better into the hip. And since there's a traction force where the band is on the hip and it's trying to pull it, there's a little bit of a distraction force which can create and help the joint give it a little bit of space. So it decompresses the hip a little bit, help alleviating some of the pinching sensations you might be feeling, and also give some input for the joint capsule to kind of stretch a little bit. Now, once the hip is loosened up from the banded distraction, following it up with some activation drills is crucial in the process. So you can't just rely on some banded mobilizations to only do the job of getting you a little bit more mobile or flexible. It's a good one to reduce some of the stiffness and tightness you might be feeling, but then you gotta follow it up with some key exercises after that. So this next one up is hip eccentrics. The purpose of this is to work on the back of the capsule or the back of the hip joint. When we're working on this particular region of the hip, it helps expand upon the actual rotational capacity at the hip because we're targeting the muscles that limit this type of motion. So this one, I'm gonna pigeon pose and I'm just doing eccentrics where I'm leading my chest forward towards my knee and then back out. And the idea is to target, again, the back of the hip, the glute muscles, to give it some input to extend or help it extensibility of the muscular tissue to then overall help in the actual flexibility of the joint. After the hip eccentrics, we have the ability to work into a new range of motion at the hip. So after this one, we're following it up with side lying, hip external rotation, active range of motion. So this one, we're working on the ability for the leg to move into hip external rotation and working on the activation capabilities at the hip joint. This overall helps the strength in the joint and helps centrate the femoral head or the hip bone into the socket a little bit better. So why I chose to work on the hip rotational capacities at the hip is because, like I said in the beginning, a lot of rotational impairments at the hip tend to contribute to this hip pinching sensation. Could there be other reasons? Of course, but most commonly it's a rotational problem. So there you go. Those are 3 exercises to, 1, reduce the stiffness and tightness at the hip, work on improving the extensibility of the muscle tissue, and then 3, working on the activation or control in a new range of motion. So by going about it with that little process, that thought process, we can start to make some good gains at the hip's mobility. So hopefully you learned some things throughout this video and gained some value and understand a little bit better about things you could do for the hip to improve its range of motion and ultimately decrease that hip pinching sensation you potentially might be feeling. Hey, before you go, if you found value in this video, I would really appreciate it if you support my channel by subscribing down below, liking this video, and don't forget to turn on your post notifications so you never miss a video from me. This is Dr. Nick. I'll see you next time.